Growth adaptation. Basic principles. An organ is in homeostasis with a physiological stress placed on it. An increase, decrease, or change in stress on an organ can result in growth adaptation. Hyperplasia and hypertrophy. Hyperplasia and hypertrophy. An increase in stress leads to an increase in organ size. Occur via an increase in the size hypertrophy and/or the number of cells. This means it's hyperplasia. Hypertrophy involves gene activation, protein synthesis, and production of organelles. Hyperplasia involves the production of new cells from stem cells. Hyperplasia and hypertrophy generally occur together, for example, uterus during pregnancy. And permanent tissue, for example, cardiac muscle, skeletal muscle, and nerve, however, cannot make new cell and undergo hypertrophy only. For example, cardiac myocytes undergo hypertrophy, not hyperplasia, in response to systemic hypertension. Pathologic hyperplasia, for example, endometrial hyperplasia, can progress to dysplasia and eventually to cancer. A notable exception is benign prostatic hyperplasia, which does not increase the risk for prostate cancer. Atrophy. Atrophy is decrease in stress, decreased hormonal stimulation, disuse, or decreased nutrients blood supply leads to a decrease in organ size, atrophy. Occur via a decrease in size and number of cells. Decrease in cell number occur via apoptosis. Decrease in cell size occur via ubiquitin proteasome degradation of the cytoskeleton and autophagy of cellular components. In ubiquitin proteasome degradation, intermediate filaments of the cytoskeleton are tagged with ubiquitin and destroyed by proteasomes. Autophagy of cellular components involves generation of autophagic vacuoles. These vacuoles fuse with lysosomes whose hydrolytic enzyme breaks down cellular components. Metaplasia, a change in stress on an organ, leads to change in cellular type. Metaplasia most common involves change of one type of surface epithelium, for example, on squamous, columnar, or urothelium to another. Metaplastic cells are better able to handle the new stress. Barrett esophagus is the classic example. Esophagus is normally lined by non-keratinizing squamous epithelium suited to handle friction of a food bolus. Acid reflux from the stomach causes metaplasia to non-sedated mucin-producing columnar cell, better able to handle the stress of acids. Metaplasia occur when reprogramming of stem cell, which then produce the new cell type. Metaplasia is reversible in theory with removal of the driving stressor. For example, treatment of gastroesophageal reflux may reverse Barrett esophagus. Under persistent stress, metaplasia can progress to dysplasia and eventually result in cancer. For example, Barrett esophagus may progress to adenocarcinoma of the esophagus. A notable exception is apocrine metaplasia of breast, which carries no increased risk for cancer. Vitamin A deficiency can also result in metaplasia. Vitamin A is necessary for differentiation of specialized epithelium surface such as conjunctiva covering the eye. In vitamin A deficiency, the thin squamous lining of the conjunctiva undergoes metaplasia into stratified keratinizing squamous epithelium. This change is called keratomalacia. Mesenchymal connective tissue can also undergo metaplasia. A classic example is myositis ossificans, in which connective tissue with the muscle changes to bone during healing after trauma. Dysplasia is disordered cellular growth, most commonly referred to proliferation of precancerous cell. For example, cervical intraepithelial neoplasia represents dysplasia and is a precursor to cervical cancer, often arise from long-standing pathologic hyperplasia, for example, endometrial hyperplasia or metaplasia, Barrett esophagus. Dysplasia is reversible in theory with alleviation of inciting stress. If stress persists, dysplasia progresses to carcinoma, irreversible. Aplasia and hypoplasia. Aplasia is failure of cell production during embryogenesis, for example, unilateral renal anginesis, and hypoplasia is decrease in cell production during embryogenesis, resulting in a relative small organ streak ovary in Turner syndrome. It's an example of hypertrophy, left ventricular hypertrophy, and is metaplasia Barrett's esophagus. See intestinal columnar mucin producing epithelium. Thank you.